Inflammatory bowel disease, IBD, is an autoimmune disorder in which the body mistakenly attacks healthy digestive tissue, causing inflammation in the digestive tract. IBD includes Crohn's disease, affecting the entire digestive tract from mouth to anus, and ulcerative colitis, affecting just the colon. Very early onset IBD is a rare category of this disease in which patients are diagnosed at a very young age, from infancy to 6 years old. In fact, VEO patients comprise only about 1 to 4% of the entire IBD patient population. Symptoms of VEO patients is similar to that of normal IBD patients: diarrhea, fever, fatigue, abdominal pain, vomiting, weight loss, growth failure, intestinal ulcers, and intestinal strictures, which are narrowing of the digestive tract walls due to inflammation in scar tissue. However, VEO patients typically present with a greater breadth and severity of symptoms, and don't respond well to traditional treatments, often because there are underlying genetic defects causing their disease, and thus VEO patients require much more aggressive treatment than most IBD patients. General IBD medications include short-term corticosteroids that rapidly reduce flares, anti-inflammatory drugs that act locally in the digestive tract, biologic agents like Humira and Remicade that suppress the immune system to control inflammation, and even immunomodulating drugs like low doses of chemotherapy. Nutrition therapy is also common, including specialty diets, tube feeding, and IV nutrition through a central line. Surgery is also significantly more common in VEO patients because of the severity of their disease, and may involve bowel resection, temporary ileostomy or colostomy, or permanent colectomy. Because of underlying genetic abnormalities, VEO patients are often unresponsive to these traditional IBD therapies, requiring much more innovative and personalized treatment. Exome sequencing can identify monogenetic defects, often related to immunodeficiencies, so that medication can target the specific defect better than general IBD drugs can. In severe cases, stem cell transplantation can essentially cure VEO IBD by building a new immune system from genetic material without VEO-associated mutations. Over 75 monogenetic defects have been found to be associated with VEO IBD, one of which is a missense mutation on the X chromosome at exon 6 in the FOXP3 gene. This single nucleotide polymorphism substitutes an adenine for a cytosine in the position 694, which changes the translational instructions for the FOXP3 protein. At codon 232, translational machinery adds a glycine residue where a cysteine residue normally belongs. Recall that both cysteine and glycine are polar amino acids, however, their side chains differ. Cysteine has a thiol group capable of making disulfide bonds, whereas glycine has a simple hydrogen, making it extremely flexible. Because the structure and function of these amino acids differ, the overall function of FOXP3 as a transcription factor is affected by this mutation, an implication apparent at every structural level, but significantly consequential at the quaternary level. Like I said, FOXP3 is a transcription factor. It works by interacting with proteins that modify histone tails to activate or repress transcription. When activating, FOXP3 works to loosen the DNA wrapped around histones, so transcriptional machinery, like RNA polymerase, can enter and transcribe. When repressing, FOXP3 works to tighten DNA wrapped around histones, so transcriptional machinery cannot enter and cannot transcribe. FOXP3 has several domains of tertiary structure that help it bind to DNA to do this function, including zinc fingers and leucine zippers. FOXP3 also has a unique fork head domain that does the actual binding to DNA. It adopts a butterfly shape through lots of alpha helices, beta strands, and loops. The leucine zipper is especially important for regulating FOXP3 homodimerization, which is the joining of two FOXP3 subunits, which is necessary for FOXP3 to bind to DNA and regulate transcription. This is an example of quaternary structure, where interaction between multiple protein subunits is necessary to perform a certain function. This mutation occurs just upstream of the leucine zipper domain. When cysteine is substituted with glycine, FOXP3 can no longer undergo dimerization and thus cannot bind properly to DNA or function properly as a transcription factor. If FOXP3 cannot act as a transcription factor, it cannot properly regulate transcription of certain genes, causing a host of issues to arise, including the unique pathology of VEO IBD. Under normal genetic conditions, the unmutated FOXP3 dimer binds to DNA and regulates the transcription of genes involved in development and function of regulatory T cells. Regulatory T cells work through the immune system to maintain a balance between inflammatory and anti-inflammatory response, doing so by encouraging inflammation when there is infection or trauma, but suppressing inflammation when not needed, thus playing a key role in preventing autoimmunity. When T regulatory cells aren't functioning properly, like when FOXP3 is mutated and cannot properly bind to DNA for regulation, T regulatory cells cannot properly suppress inflammatory responses, causing the immune system to trigger inflammatory responses in healthy tissues, thus causing autoimmune disorders like VEO IBD.